Mr. Secretary, whoever's whistling, really, it's throwing us off. Can you take the roll?
Yeah.
Oh, we don't have a quorum. Okay. Well, okay, we're going to forego the roll and start as a subcommittee. We're going to start with House Committee substitute for House Bill 195 and 1119 with Representative Seitz. Please, yes, go ahead. Thank you. It wasn't you that was whistling, right? It wasn't you that was whistling, was it? Oh, that's so weird. I do, actually. All right, begin when you're ready.
Thank you, Madam Chair, esteemed committee members. I bring to you House Committee substitute for House Bills 195 and 1119, the Born Alive Abortion Survivors Protection Act. I have numerous pieces of legislation dealing with the topic of life, which is God-given and taken only at the greatest need. This is a protection bill for infants outside the womb, those that have survived an abortive attempt. In a nutshell, the main focus of this bill is found on page 1, lines 4 through 6, and lines 10 through 12, which state, a child born alive during or after an abortion or an attempted abortion shall have all the rights, privileges, and immunities available to other persons, citizens, and residents of this state, including any other live-born child. Lines 10 through 12 state, exercise the same degree of professional skill, care, and diligence to preserve the life and health of the child as a reasonably diligent and conscientious healthcare provider would render to any other child born alive at the same gestational age. In 2024, the American Journal of Obstetrics and Gynecology analyzed 13,777 late-term abortions between 15 and 29 weeks performed in Canada and found that 11% resulted in live births. Because of gaps in national and state abortion reporting, the number of babies born alive in the United States is unknown. During a recent survey in which 8 states responded, available data shows that 284 babies were reported born alive, having survived an abortive attempt between 1997 and 2024. The Canadian Institute of Health Information showed at least 1,155 babies were born alive during late-term abortions between 2013 and 14, and again during 2021 and 2022. The very definition of late-term abortion is imprecise and shifting. The gestational age at which an unborn child can survive outside the womb with medical support is decreasing, with babies surviving at 22 weeks gestation and slightly earlier. Data from the Centers for Disease Control and Prevention indicates that roughly 1% of all U.S. abortions are carried out at or after 21 weeks gestation, as many as 10,000 late-term abortions per year. The true total may be even higher because several states that allow abortion through all 9 months of pregnancy do not share data with the CDC. Federal law states that all infants who are born alive following an abortion are full persons under the law. However, the federal law does not ensure that these infants are given proper medical care, hence our legislation today. This legislation considers the infant to be like any other person born alive, and they should receive care consistent with those of the same gestational age. Madam Chair, esteemed committee, my friends, this bill only concerns abortion because that is what was attempted to end the precious life. No one can deny that the baby born alive despite the circumstances, is a human being, a miracle of creation, a person of dignity, unique in the universe. If the infant fought that hard to live, let's give them a chance. And now I'd allow my fellow representative to present.
Thank you, Representative. Good morning, Madam Chair and members of the committee. For the record, Holly Jones, representing the 88th House District of Missouri. I don't know really what to say to follow that, except for he always allows me the opportunity to share the terrible part of the repercussions of what happened to these children. So let me just share a couple of things. Currently, like he had stated, there's no federal requirement for the reporting of cases of infants surviving abortion. There's states, there's only 8 states that require it on a state level, and those states are Arizona, Arkansas, Florida, Indiana, Ohio, Oklahoma, South Dakota, and Texas, Michigan, and Minnesota. Those are the only ones. So we really don't know how often this is happening except in those states. So the number is actually much higher than what we had stated in that 284. The Born Alive Abortion Survivors Protection Act actually passed through Congress with bipartisan support, but died in the Senate. Not sure about that, but this federal bill would require, the federal bill required abortionists and healthcare practitioners to present and exercise the same degree of professional skill and diligence to preserve the life. Now, whether these children made it out by sheer will and determination or by divine intervention, it is our morally held belief that they deserve all of the medical interventions or even palliative care. Let's say they're not going to survive, but we should provide that comfort care to them, even if it's for a few hours. And whenever, to me, it is murder if you aren't protecting that child outside of the womb as well. So I want to talk about a case that was prosecuted in, a physician that was prosecuted in DC in 2013. Some of the people that had testified on this bill, actual workers from that clinic, stated that during the trial that she had witnessed, this physician snipped the necks of more than 30 babies. A 28-week-old baby boy was found frozen in a gallon water bottle. One of the babies was reported moving and breathing for 20 minutes before an employee cut the spinal cord. And I know this is as hard for you to hear as it is for me to say. The physician, Gosnell, severed the spine of one breathing, moving, born-alive baby and put the body in a plastic shoebox for disposal. When authorities searched Gosnell's office, they found bags and bottles holding aborted fetuses scattered throughout the building. Many other horrific details are surrounding that case, but if it happened there, what's to say it didn't happen anywhere else? We're asking for the Born Alive Abortion Survivors Protection Act to be passed through the House and the Senate and onto the governor's desk to save babies that make it out of these horrific procedures. And with that, we'll take any questions.
Thank you, representatives, for being here today. It's nice to be able to see you guys, and maybe we need to have more House bills heard so we can get to see each other. But thank you for bringing this forward. Can you talk to me just a little bit about the data that you were talking about? What legislation brought about them being able to share that data? Is that something that's included in this bill?
The data that we have currently?
Yeah, you were talking about there were 8 states. Some of them, the data isn't as readily available. Did I misunderstand? Or
No, from those 8 states, we took that from the Family Research Council, who had done the studies on that.
And then I think you said that there were some states that you didn't have the data on, and so I was just curious.
Because there's no federal reporting that you have to, it's up to the states to report that data. So those 8 states have come forward and said, we will report. And so that's where we're getting those numbers.
So those 8 states are reporting to the federal government.
Mm-hmm.
So is that part of this legislation where Missouri reports to the federal government?
No, that's not in
Okay.
the legislation.
This is mirrored off the congressional bill.
Okay.
And so I think this is, again, one of those types of legislation that we're going to have to take piece by piece. And the most important piece being making sure that it's not happening or that those babies outside the womb are cared for.
It's interesting to me as we have these, you sit on the House side of this legislation where we hear a lot of these bills. And I think even with people who I sit on the opposite side of the aisle with, when we talk about the life issue, I always ask them, is it the life is up for grabs, or is it that we're concerned about finances and economics? And 9 times out of 10, they'll tell me economics. And so in this committee and as the chair, it's always my desire to say, okay, we need to be better about separating those things and the political reality and talking about what brings us to that decision when it's really not the life issue so much that's a debate, but how to take care of that child. So I think this is one of those first important steps. Thank you.
Agreed.
Any
Thank you.
questions for, yeah.
I just want to thank both of you for bringing this legislation up and for being very diligent and working hard to save life. So thank you very much.
Thank you, Senator.
Thanks, Senator. I'd like to say, because it was mentioned, the attempt to discuss this issue with friends on the other side of the aisle. When we passed this in the House on third read, we received numerous votes in favor from, I'll just say it, from strong Democrats. They voted in favor of this legislation, and I think we had between 9 and 12 that voted present because they did understand that we're talking about an infant born alive after an abortive attempt. That is, regardless of your even religious beliefs, your political beliefs, that's a human being and deserves the exact same health care given to any other infant of that gestational age. And I think the folks on the other side of the aisle realize that, and I hope they'll do that in the Senate as well.
Thank you. Thank you for sharing that. All right, that concludes that testimony. We'll begin with those here in support of the legislation.
Thank you, Madam Chair.
Thank you. You're welcome to stay if there's questions. Mhm. I don't think so. We've got 2 hours.
Good morning, Madam Chair, members of the committee. For the record, Susan Klein, representing Missouri Right to Life, here to go on record in support of House Bills 195 and 1119. And we thank the sponsors for bringing this forward and for everything they've done to protect life. We just appreciate them very much and appreciate you for hearing this bill. This is really, it has the title of Born Alive Abortion Survivors Protection Act, but reality is it's a health care bill. This is a baby outside the mother's womb, a human being just like all of us, and deserves care. You talked about economic issues and whether, people who fight against us a lot on the abortion issue. Is it economics or is it that they just don't care about the baby? I'll give you an example of one of our supporters who was actually praying on the sidewalk in front of the clinic, abortion clinic in St. Louis. This has been a few years ago. One of the people going into the clinic stopped and talked to them, and one of us asked, what would it take for you to keep your baby and not go into the abortion clinic? And she shared her issue about having she had 5 children at home, and she didn't know that she could afford to take care of another baby. And so they asked, what would it take? And she thought for a moment, and she said, I need a washer and a dryer. Because I have so much laundry because of my children. And our people got together and they bought her a washer and dryer and they developed a relationship with her. She kept her baby, and that help was there for her. And I know through the Alternatives to Abortion and other programs that you all have put in place, there's a lot of help for people to choose life for their babies. So we strongly support this legislation and appreciate your support.
Thank you. Appreciate you being here and being willing to testify. Any questions for the witness? Okay, seeing none.
Thank you.
Thank you. Thank you. Next in favor? Is there anybody here to testify in opposition? Okay.
Thank you, Madam Chair, members of the committee. Samuel Lee with Campaign Life Missouri to go on record in support of House Bills 195 and 1119. And again, want to thank our sponsors for working so hard on this this session. And this is a bill, or versions of this bill have been introduced in the General Assembly for a number of years. Senator Bob Onder in the latter part of the 2010s, Senator Eric Burleson, when he was in the Senate, he had this. It almost passed in 2019. It was part of the heartbeat bill, but it was taken off in the process. And Senator Rick Bratton has it this year on the Senate side as well. And also Congresswoman Ann Wagner is the prime sponsor in the U.S. House, and so there's a strong Missouri connection to this as well. I just want to follow up on that study from the American Journal of Obstetrics and Gynecology, and I'll leave this with you, Madam Chair. In terms of treatment for these children, again, 11% of these children who are aborted during late term survived an abortion, at least for a short period of time. And what the study found is the type of treatment that was provided to the child. And that treatment and this bill are consistent with each other. So it found that between 15 and 19 weeks gestation, 19.4% of those children who were born alive were admitted to a neonatal intensive care unit. almost 26% of those between 20 and 24 weeks were entered into a NICU. 21% of those up to 29 weeks, 25 and 29 weeks. There were some who did not go to NICU, but they were given palliative care. The point is that they were not abandoned. And that's what this legislation makes sure, is that these children are not abandoned, whether it's a NICU or palliative care. Whatever care would be given to a child who was born at any time for any reason other than because he or she was aborted, that same care should be provided to this child. And we ask your support on this, and hopefully we can get it passed this year.
Thank you. Can you, any of you, either of you, talk to me a little bit about what that looks like when a woman goes into an abortion facility, has an abortion, and then the baby's born alive? Like, what is the process? Do they waive their rights as a parent? Do we know what that process looks like?
Well, they don't waive their rights as a parent.
I mean, the child's born alive.
Right.
So what does this look? What does it look like?
Well, I mean, that's yeah.
Oh, thank you.
Thank you for your question. Actually, in legislation heard yesterday, the abortion physicians would have admitting privileges at hospitals.
Okay.
So we're hoping that these two will marry up in a way and be able to work together.
Okay.
And then they would be able to transport or care for those physicians under emergency, circumstances, or care for those babies, I'm sorry.
Okay, and what happens in a situation? There's no punitive oversight. So we're counting on those doctors who have performed the abortion to.
As it would be law, they would be required to,
Okay.
and then there would be penalties for not.
Okay.
I think, Senator, that's the problem with not having data and actually having the providers present exactly what went on, what happened in that room. And I think mandatory reporting is something that would be very necessary. If the abortive attempt failed and the baby survived the abortive attempt, we need to know exactly what happened in that room and who's responsible for that child. And are they giving them the palliative care and or care that they would for any other child of that same gestational age? I mean, this is a human being born. They're outside the womb, and they deserve that care. And I think if we had the proper reporting mechanisms and so forth, if we actually were made aware of what went on in that room, I think we might be shocked. And I think that's one of the reasons that they're not reporting necessarily what happens. And mandatory reporting would be part and parcel of this bill as well.
If I can add, on the bottom of the first page, subdivision 4 of subsection 1 requires other healthcare providers who are present there to report this as they would in cases of child abuse or neglect. We already have that in the law. So in that same way, other people there, that's a safeguard to make sure that those who are aborted the child are taking care of that child, or ensuring that the child is taken care of.
Yeah, thanks. I see that now. Thank you. All right. Appreciate your testimony. Did you have any questions? Okay. Next in favor?
Good morning, and allow me first of all, Madam Chairman, to apologize. That was my phone. I thought I had it on silent, but it wasn't. My name is Timothy Faber, and I'm here to speak in favor of House Bill 195 and 1119. We often perceive ancient Rome as being a very civilized society. And yet, in reality, ancient Rome was a very barbaric society, because in ancient Rome, if a child was born into a family and it was unwanted, generally because of it being female rather than male, they would simply take that child out to the city dump and let it die from exposure to the cold, to the heat, to the rodents, to whatever the case may be, because the child simply was unwanted. A child upon whom abortion has been attempted obviously is an unwanted child. And when we allow that child to die for lack of appropriate medical care, without even attempting to save its life, we are no better than the barbaric ancient Romans. We could also take the angle of these unwanted children. They're only unwanted by their moms. There are over 2 million Americans who would love to adopt a child, a baby. And so if we could work on making the process of adoption more affordable, more accessible, then perhaps we could reduce the number of children who are unwanted, uncared for, and allowed to die. And one more thing I would like to mention. Any other victim of attempted murder, whether it be myself or anyone in this room, we would be rushed to the hospital and given whatever treatment necessary in an attempt to save our life. Why should that same treatment, that same attempt to save the life, not be given to someone simply because they are less than 9 months from their fertilization? Thank you.
Thank you. Thank you for your testimony, and thank you for being here. Any questions for the witness?
Thank you for your testimony. I completely agree with you about our adoption system, too. That definitely needs some overhaul. And to me, too, even just listening to this, it's a little shocking we even need legislation for this,
Oh,
quite
yeah,
honestly.
definitely.
So thank you very much.
Any other?
Yeah, just a brief comment. I mean, I highly recommend people to watch Gosnell and to follow that case. I mean, this isn't about abortion. That act potentially already was attempted and occurred. This is about a living human being outside of the womb. And if you actually investigate what occurred with Gosnell, it was horrific. They considered it a house of horrors for obvious reasons of actual murders occurring, snipping the spinal cords of a living, breathing human being sitting on a table. Imagine, just because of age differences, if that happened to a 5-year-old or a 45-year-old. I mean, it's just the thought that in society we're having to pass. I mean, I hate to say not ridiculous pieces of, but that we have to go to this, and that it's being opposed by groups, so that we're going to have actual testimony against bills like this to protect a living human brain breathing human being outside of the womb. Dehumanization to the umpth degree. It's unconscionable to me, and so I appreciate your testimony. Appreciate this bill. Well, I hate the fact that we have to have bills like this, but thank you.
All right, thank you. Thank you for your testimony again. Next in favor?
Good morning, Madam Chair, members of the committee. For the record, Jamie Morris with Missouri Catholic Conference here in favor of House Bill 195 and 1119. I won't repeat what the others have said, but do want to echo my thanks to both bill sponsors for bringing this forward, a very common sense measure. We've talked a lot about the more gruesome scenarios, the Gosnell types, but also, it's important to remember that our current law is very much silent on the duty of care that's owed, whether it's negligence of not providing care to the unborn child, and so this bill is very necessary to close that gap and to very much give us a clear guidance as to the duty of care that's owed, so that we don't have as we have a Missouri resident, Melissa Oden, who started her life being abandoned and left in a closet, basically. And so we are obviously very much in support of this legislation, think it's a good thing, and hope that the committee considers and passes.
Thank you.
And be happy to take any questions.
Appreciate that. Any questions for the witness? All right, seeing none, appreciate your time. Anyone else here to testify in favor of the legislation?
Lisa Panett with Armorvine, and we really appreciate the civil liability that exists in this bill. And also, if I were to add one thing, it would be that the whistleblower that is already in the bill, that if they would have some education, that would probably even be better. Because we saw during COVID that we really didn't have whistleblowers within the hospital because they were afraid for their jobs. And I would say that the same thing would probably exist here. And so there should be some education on the penalties that would exist for them if they don't report what's going to happen. That's
Thank
all.
you. Any questions for the witness? Seeing none, thank you for your testimony. Next in favor?
Hi, I'm Chris White with Liberty Link of Missouri. We just wanted to go on record. We're very thankful for this, and I'm in agreement with everyone that testified in favor, including especially the reminder about Melissa Oden, who has an organization, and she's trying to gather several abortion survivors, and she has an incredible story if people look that up. Thank you so much.
Thank you. Any questions for the witness? Seeing none, appreciate your testimony. Next in favor? Going. All right, that concludes testimony in favor. We'll begin testimony in opposition. Just come forward when you're ready.
Good morning. My name is Maggie Olivia. I use she, her pronouns, and I'm here on behalf of Abortion Action Missouri in opposition to this bill. I'd like to start off with a couple fact checks before I get into my testimony. First of all, the study cited by Family Research Council is not a medically reputable organization. It is a political think tank operation. The quote-unquote study cited by ACOG, the American College of Gynecologists and Obstetricians, actually proves that the situations brought about by this bill do not exist. The subjects of the study all received care and care at the consent of their parents and with their medical professionals. I'll also say that Mr. Gosnell, who was mentioned multiple times, is a convicted serial killer who was actually convicted in the state of Pennsylvania. Pennsylvania does not have a law like this, but there is existing laws to protect people against murder, which is ridiculous. This bill is ridiculous. These bills weaponize anti-abortion propaganda in order to villainize care providers, but no such procedure as abortion after birth exists. Obstetricians, gynecologists, just like physicians in all fields of medicine, are dedicated to protecting, preserving, and promoting the health of their patients. These bills aren't about abortion, don't impact people who are seeking abortion care, but they will impact people who are facing devastating pregnancy loss and will lose the right to choose whether or not they want to spend those last few minutes with their child, or if their child should be taken from them and violently undergo medical procedures that we know will not preserve the life of this child. When an infant is dying, these types of bills take away the parent's ability to decide the type of compassionate or palliative or comfort care that is best for their family and whether or not their infant is allowed comfort care at all. Infants with few moments, hours, or days to live would be taken out of the arms of their parents, hooked up to machines, and forced through painful, violent, and unnecessary medical procedures that would only prolong their suffering, and again would prohibit families from deciding if they want their babies to receive comfort, palliative care, compassionate care. If this bill becomes law, parents and doctors would have no say in how those last few minutes of hours with their child's life will be spent. When people are making difficult, complicated, and personal medical decisions, we know that one-size-fits-all laws do not work. I would also like to note, as the bill sponsor mentioned, the American College of Obstetricians and Gynecologists, as well as the congressional version of this act. Here's a list of medical organizations who testified in opposition to this bill at the federal level for those very same reasons. The American College of Obstetricians and Gynecologists, the American Academy of Nursing, the American Academy of Pediatrics, the American Association of Child and Adolescent Psychiatry, the American College of Nurse Midwives, the American College of Physicians, the American Gynecological and Obstetrical Society, American Psychiatric Association, American Public Health Association, American Society for Reproductive Medicine, American Society of Hematology, Council of Chairs of Obstetrics and Gynecology, Infectious Diseases Society for Obstetrics and Gynecology, National Association of Nurse Practitioners in Women's Health, North American Society for Pediatric and Adolescent Gynecology, Physicians for Reproductive Health, Society for Maternal Fetal Health Medicine, and Society for Family Planning. These are the experts who actually care for patients in these situations, and they are telling us that this bill does not protect anybody. It will take parents' rights away to be able to provide their dying infants with compassionate palliative care. Thank you.
Thank you. I have a few questions for you. Why are they dying?
Pregnancy is really complicated. There's all kinds of things that could go wrong with
In the
pregnancy.
case of a woman walking into an abortion facility, why is the child dying?
I don't agree with your premise, and I will say that the situations that are brought about by bills like these are often taking places in hospitals because people are going through complicated pregnancies already and are
there
requiring
should be no problem,
complicated
right,
care.
for them to transition into receiving the kind of care that they need. But we are talking, specifically is addressing children that are born alive, right, in the process of getting an abortion. So it's curious
I
to
disagree.
me that so we're just going to agree to disagree. Didn't they decide the kind of care they wanted their child to have when they walked into an abortion facility?
The types of situations brought about by this bill are happening in hospitals. They're not happening in abortion facilities.
Not at all. So Melissa Odin doesn't exist? There's not a child that hasn't been born alive. You're telling us that
Did she
this
receive care?
population, you're telling us that this population just doesn't exist, is what you're telling us.
Did she receive care even though this bill
Is
was
that
not
what you're telling
was
us?
not existing
Is
law?
that what you're telling us?
I disagree with your premise.
I disagree with your premise. So
Okay.
Thank you. All right. Any other questions?
Madam Chair, am I allowed to comment?
We'll go ahead and let the senator.
Sure.
What is your organization? You came after some other organizations that testified. Are you a political think tank, abortion rights advocacy group?
We're an advocacy organization for reproductive freedom.
What was the name of your?
Abortion Action Missouri.
Okay, so you're trying to be slick, and I mean, so you are a political think tank organization, correct?
We're an advocacy organization. I wish we had the money to be a think tank organization.
I mean,
but we
I've
do
seen
not.
your ads all over Facebook. It seems to be a political apparatus.
We actually don't have ads on Facebook. You have to pay for those, but we do have posts.
Oh, I'm just,
Thank you for reading
that's
them.
what I'm saying. I mean, but you are absolutely a think tank for abortion rights. I mean, so you're just trying to muddy the water, it seems.
I disagree.
So when you're talking about comfort and compassionate care,
Yes.
that just blows. Okay, you're talking about last minutes for the child, having comfort and compassionate care. We're talking about taking care of the life of a child whose parent has sought an abortion, and you're talking about the last few minutes with the child and the parent seeking compassionate and comfort care. I think they were pretty okay with the last few minutes of their child not being comfortable and compassionate.
Well, to get back to my line of questioning, so Melissa Odin is a survivor of abortion. I've personally talked with her and her story. Her mom set out to have her killed and actually thought she had been killed up until she confronted her. She had been put in a closet and not received medical treatment or care. She just, by the grace of God, survived the abortion procedure. So you don't think that that child, that she should have received any sort of medical treatment, life-saving care?
I don't think that that situation would be impacted by this legislation. I think that the people that abused her would be covered
Do you
by
believe that
other
the
types of
medical
law.
facility, the doctor that refused treatment of her, did their Hippocratic oath of rendering aid to someone in need?
I know that doctors who practice medicine in the state of Missouri take their jobs very seriously and abide by their Hippocratic oath, and I'm not
Do
familiar
you
enough
think
with the
Hermit
situation to pass
Gosnell
a
took
judgment
his
on
Hippocratic
on a doctor.
oath very seriously? I know you. I mean, you
I
want to
think Dr.
scoff at that case, but it's a clear-cut case of someone who was snipping spinal cords and proven in a court of law to be snipping spinal cords of infants after abortion procedure.
And he was held accountable for those crimes under existing laws. The state of Pennsylvania does not have this legislation, and this legislation is not necessary to convict people who commit crimes.
Well, I mean, it's civil, penalties. Is that what you're against? Is that what you don't like about this legislation?
No, this legislation is a one-size-fits-all piece of legislation that is
If someone is
designed.
born alive after a botched abortion.
I
I'm-
define
this is
abortion in congruence with
unconscionable.
medical
You can be
professionals.
for abortion and be an advocate for the procedure in of itself, but someone that's born afterwards that needs rendered care, and your testimony
People who are born
is
are
saying that
receiving
someone
care.
should be denied actual life-saving treatment,
I'm not saying
regardless
that.
if somebody, you called it comfort care. It's not. It's life-saving care.
Sometimes it can be, and sometimes it is comfort
But that's
care.
not what you testified. You said it was just comfort care, and that
Sometimes it can be, and sometimes it is comfort care. Pregnancy is
But it's
incredibly complicated, and one-size-fits-all solutions do not work.
you're just being really slick in your testimony and trying
Thank
to well, it's actually laughable that you're trying to be slick on such a egregious act. I guess that's what's so.
I think
guess
it's egregious to deny parents the ability to
to
provide
kill their
compassionate
kid
care for their children.
after they've been born alive.
I think it is egregious to deny parents the ability to choose compassionate palliative care for their dying
What's
infants.
compassionate about that? Tell me, what is compassionate
About
about
palliative
a
care?
child literally dying and not being rendered aid? What's compassionate about that?
Palliative
On a cold
care.
operating table, steel table, literally sucking
Those
for
situations
breath.
are not happening, Senator.
It absolutely is happening.
Do you have evidence to the contrary that it isn't happening?
I do that list of medical
No,
professional
those are just
associations.
that they're just in testimony. They're just offering testimony against the bill. They're
Yes.
not. So you're, unless you have statistics that say that it's not happening absolutely, then there should be no harm in passing legislation that says if it does happen in the situations that it does happen, then they are receiving the care that they need.
That is
And the fact
already
that-
happening.
The fact that you say or define the word compassionate care in the way that you do is absolutely offensive. So
I am
anyway,
offended by this bill.
Thank you.
appreciate it. Go ahead.
I love our process where we can speak on both sides of the issue, and appreciate you coming and sharing your side. But you and I, and it sounds like from my colleagues, we're on polar opposites of this. But I just want to thank you for exercising your right to come and share what you believe is true.
Thank
but I
you.
completely
Thank you for
disagree
letting
with
us
you.
testify.
Yep, thanks.
All right, thank you. Any other questions? Seeing none. Make sure you leave your, if you didn't, make sure you leave your witness form on the desk. Anyone else here to testify against? Thank you. Seeing none, that concludes the hearing for House Committee Substitute for House Bill 195 and 1119. Thank you, representatives. Thank you. Appreciate that. All right, we're going to move to House Bill 825 with Representative Stinnett. Well, I think we have, it takes. Do we need one more?
Good morning, Madam Chair, members of the committee. For the record, Melanie Stinnett, representing District 133 in Springfield. House Bill 825 should be familiar to you in language as it came through your committee. This is a bill that addresses telehealth, ensuring that audio-only telehealth options are available in our communities, and ensuring that third-party payers are not making decisions about what telehealth options patients and their physicians can utilize. I'm happy to take any questions.
Thank you, Representative. Any questions for this witness? Seeing none? Appreciate that. We will move to those who are here to testify in favor of the legislation.
Madam Chair, members of the committee, Jacob Scott here with the Missouri State Medical Association and the Missouri Association of Osteopathic Physicians and Surgeons. I want to go on record in support of the bill, thank the sponsor for bringing this bill forward. We believe this is a common sense way to improve our healthcare delivery model, and be happy to answer any questions.
Thank you. Any questions for the witness? Next in favor? What? I know, but we switched roles.
Madam Chairman, members of the committee, my name is Kaina Iman on behalf of the Missouri Nurses Association. We'd like to echo what our partners with the physicians have said and support this legislation with Representative Stinnett.
Thank you. Any questions for the witness? Seeing none? Next in favor?
Very briefly, Madam Chair, members of the committee, Brian Bernskater here on behalf of the Missouri Academy of Family Physicians. Telehealth is an amazing tool. We want to continue to be able to utilize it to the best of our abilities to help extend care to patients. We certainly support the representative's amendment or bill and encourage your all support.
All right, thank you. Any questions for the witness? Seeing none, appreciate your time. Next in favor, House Bill 825.
Good morning, Garrett Webb, registered lobbyist for the Missouri pediatricians and the Missouri psychologists. Thank you all for voting this bill out in its Senate form and hopefully voting it out in its House form.
Thank you. Next in favor? We should be asking who played softball last night.
Not me, I'm walking fine. Kara Hoover on behalf of SSM would like to go on record in support of the bill.
All right, thank you.
you.
Next in favor? Softball, yes or no?
No. Madam Chair, members of the committee, Sarah Schlemer here on behalf of the American College of Obstetricians and Gynecologists. Just want to go on record in support.
Thank you. Thank you. Next in favor? Everybody but you. No, just kidding.
No softball. Jamie Murphy, registered lobbyist, Missouri Hospital Association, also wanting to go on record in support.
Okay, great. Any questions? Nope.
And I
All
did
right.
my form online.
Thank you. Next in favor? Going. Busy day for you?
Busy day for everybody. Madam Chair, David Winton here on behalf of BJC Healthcare, Cox Health, National Association of Social Workers, Missouri Association of Rural Health Clinics, Rankin Jordan Pediatric Bridge Hospital, and the Reach Foundation. I want to thank the sponsor and go on record in support of the legislation.
Thank you.
Thank you.
Any questions for the witness? Seeing none. Appreciate your time. Anyone else here to testify in favor of House Bill 825? Seeing none. Anyone here to testify in opposition? Seeing none. Thank you, Representative. Any closing comments? All right. Thank you. That concludes the hearing for House Bill 825. We are now going to hear House Committee Substitute House Bill 339. Representative Kelley, begin when you're ready.
Thank you, Madam Chair, committee people, for hearing my bill, House Bill 339. I'm Ann Kelley, District 127. So what House Bill 339 does, up until a few years ago, all the child care licensing was done through the Department of Health and Senior Services. In 2021, the Office of Childhood was created as part of DESE, and thus adding the responsibility of child care licensing to this department. In the transition of the Office of Childhood, part of the statutes did not really get transferred, and I'm here today to rectify that. Before this movement, when someone hotlined a facility, it would be completely anonymous. Now it is not anonymous hotline call. The department publishes these complaints online with the person's name. You can imagine what happens in small communities where everyone knows everyone. Ultimately, by creating the hotline, a documented and published report makes it where individuals do not feel safe reporting issues with daycare facilities. As someone who's owned a daycare and someone who has sent their child to a facility, we need to get this fixed so that we can ensure facilities are doing what they should be doing and keeping our kids safe. So this was sent to consent in the House, and it does have an emergency clause on it.
Thank you, Representative. Any questions for the witness? Thank you very much. Anybody here to testify in favor of House Bill 339? Anybody here to testify opposed? Well, thank you, Representative, very much. Appreciate it. That concludes testimony on House Bill 339. Did she have an order she wanted to go in?
I think it would just be
835? Okay, we will hear House Bill 835. Representative Farnan, begin when you're ready.
Thank you, Madam Chair and Committee, for hearing me today. My name is Jeff Farnan. I represent District 1. I am here to present House Bill 835. This bill would allow for an in-home licensed daycare provider to care for up to 2 related children, and said children would not be counted in their daily count for which the provider is licensed. And I did not play softball last night.
What?
I can tell you moved really too easily to get
I knew how I would feel if I did, so I didn't play.
like me.
He's my basketball buddy, so.
I would have played that.
All right. Any questions? Okay.
Yes.
I have no problem with this. I like it. I'm just curious as why you presented this. What's the problem?
My wife had a daycare, and whenever Nathan's Law was passed back in, I think it was 2019, she had to give up 2 of her kids to make room for 2 of our grandkids.
Yeah.
So it caused this lady that we gave her up. She couldn't find daycare, and she ended up losing her job. And so that's the reason I'm bringing it today.
Yeah. Have you seen that this has been, a common problem?
It is.
Widespread?
Yeah, it is. And what's happening is these licensed provider, they get, help from the state. They have the fire marshal and stuff. They have daycare. What's happening is, since they can't keep their grandchildren, they're going unlicensed. And once they go unlicensed, they don't get any of that services that the state provides. So the goal of this bill is to keep more people in a licensed daycare. I mean, by allowing, just to keep their 2 grandkids or kids or, whatever they want to keep that's related to them, it keeps them in a safer environment.
Yeah, very good. Thanks for bringing this forward, and thanks for your testimony.
Any other questions for the representative? Okay, seeing none. Thank you for your testimony, and thanks for bringing the bill forward. Appreciate it. All right, you did the in favor? No, we haven't done that. Okay. Anybody here to testify in favor of the bill? Seeing none. Anyone here to testify in opposition?
Good morning. Robin Schultz, Director of Policy and Advocacy for Kids One Missouri. We do go this is so weird. I'm not used to testifying against a bill. It's hard to testify against this. I know that the intent of the sponsor is a good intent. We want to solve the child care crisis. We want to make sure kids are being cared for. I think there are better ways to do that than messing with ratio. I want to thank the governor for his executive order to say, hey, we need to address our licensing issues. We need to remove barriers. We want more people to get licensed. He's right. Licensed care is a great way to go. If you're unlicensed, you can only have 6 kids. Licensed allows up to 10 in a home. And when we've talked to providers who are unlicensed, usually the reason for not being licensed has nothing to do with kids being related or not related. It has to do with the barriers to licensing. So I think that the executive order and really addressing our licensing structure and all the regulations is the way to go. And I'm excited to see what comes of that. I do want to just address what our ratio currently is so you get that. This is a family home setting. And so a family home setting is in someone's living room. It can be. They use their own kitchen. It's usually one person. Maybe it's the mom, maybe it's a dad in a house, but there's not a backup adult. There's not a cook, there's not a nurse. It's one adult, they can have up to 10 children with 2 being infants. This would allow a person in an in-home setting to have 12 children, with 4 of them could be infants and 8 of them could be 2-year-olds. And I want to compare that to a childcare facility. If we have a 2-year-old room, they can have 8 2-year-olds. That's it. If we have an infant room, they can have 4 infants. So what we're saying is that this in-home facility, they can have the equivalency of 2 classrooms from a childcare facility with 1 adult and no backup. That's concerning to us. When you look at other states, we have one of the highest ratios with 10-1. And if you look at the states surrounding Missouri, we are the highest. Kentucky, I think, allows up to 10, but those all have to be 3-year-olds. And none of the surrounding states allow a child related to the provider to be exempt from ratio, because a child is a child whether it's related to you or not. I just want to kind of wrap this up by saying, people ask me, what's a good ratio? And it's tricky. Ratio is hard because we have to balance safety. How many kids? What's the most kids I can have and keep them safe with quality care? And the reality is we could put 12, 14, 15 kids in a room and keep them safe. You put them in cribs, you put them in front of a TV, but that's not quality. And that is not going to provide children ready for school, doing what they need to do. We need to take into account how children were created. They were created to explore, to climb, to put things in their mouth, to take risks. We want our children to develop that way, and that helps their development. We need to make sure we're doing it with proper supervision. Also, children were created to be in relationship with their parents and caregivers. If you think about child development, language and speech comes because of that one-to-one connection with the caregiver or the parent, that back and forth talking. When children are fighting and they're trying to learn how to handle situations, it's because the caregiver comes in and models that for them. If we do not have proper ratios, it's just not going to be a good situation for children. And so I just ask that you keep the ratios where they are at 10-1.
Okay. Any questions for the witness?
This is one where I really struggle. Because you said it's, child needs to run, frolic, play. Is that what happens in school settings? Where we have literally 25 kids to 1 teacher?
I'm not going to argue with you.
Well, that was your testimony, though.
No, I would love to see school settings being a lower ratio. That would be great. That is how kids learn. But is it to the detriment
of the kid, though?
It's what now?
Is it to the detriment of the kid?
I would say yes. I think when you're, as a teacher, when I had smaller ratios, I could help those kids one-on-one. We did have the freedom to do that.
Well, but I went through school and had large class sizes, and to say those to the detriment, I just disagree. I just see we continue to dwindle these ratios, creating this massive need, this massive incapability to afford child care. And as a parent, I know with my kid, or my youngest daughter, we went to an in-home facility, and I, as the parent, looked around and saw whether or not the ratio was proper. I don't feel that it's the big, massive arm of the government's need to step in and tell us, what we think is best for our children. I grew up having to go to daycare, and it was a large class in the woman's basement, and it was structured very well. We played outside, but these ratios were never a part of the equation. I know I'm probably dating myself, but at the same token, it's bypassing these sorts of measures, Nathan's Law. We've created an environment where nobody can afford anything anymore because it's drove up the cost. So I think we've got to personally remove a lot of these barriers and give parents back the capability to look and see if, hey, I don't like this facility, so therefore I'm not going to go to it. And that's where I think we continue to play the mother may I and the big nanny state, and that's where we've gotten.
Yeah. And we're just going to have to disagree on that one. I think we're giving state funding to some of these facilities through subsidies. We should have the expectation that there's an element of quality.
We're giving that because we've created the environment. It's the Ronald Reagan, if it moves, tax it. If it continues to move, regulate it. If it stops moving, let's subsidize it. And that's exactly what we've seen with child care. Would you not agree with that?
I think, no.
No? Okay. All right.
I understand what you're saying. I hear your concerns.
Well, we've literally, from dawn of time, have never had ratios on kids and watching kids. Now, all of a sudden, in a 10-year span, we've literally limited it so much to where it's drove the market to where it's unaffordable. So I guess from millennia prior to 10 years ago, did we survive? How are we all sitting here?
Yeah,
That's where I'm just like, that's why I want to continue to press in as a father of 5 kids, and my mom having an in-home. I grew up in chaos with a bunch of kids, and I don't think it's to the detriment. So,
okay, well, and we'll have to disagree. I think it is challenging balancing. I mean, you talked earlier, economics versus the child, the life, and we know with lower ratios, there's the more of the interaction. It is safer, and not every family has the ability to go in and say, "Oh, this doesn't look so safe. This is a bit wild. I'm not sending my child here." They have to go to what they can afford, and so okay, maybe it's 20 kids. It's like to his argument, it's unlicensed. It's not following laws, but that's all I got. We got to figure out how to balance that. How do we make sure kids have quality care? They're safe. Families can afford it, and there's a lot of different people working on that. There are different bills to support that. I would just say this is one that maybe there are better ways to do it. The next bill, I strongly support. It attacks the issue from a different angle.
Just one question I have. When I have when my kids have friends over, usually my kids know the rules. And that's the one caveat that I think we might just discuss, is that my grandkids know the rules. So when there's people over that aren't familiar with that, that's a whole different issue than when somebody's constantly at my house and I have a relationship with that kid. Usually all it takes is for me to say, you're busted if you do that. And there's just a different relationship. And can
I actually speak to that?
Yeah.
Because you're right. My kids know when I give them that look, they better back down. As a homeschool mom, because 16 years before doing this, I homeschooled, it can be really tricky to draw that line between I'm parent and I'm teacher. And when you have these kids in your facility and your own children, sometimes the challenge is, I know to my child, you're allowed in my kitchen normally on the weekends, in the evenings. But when you're one of my kids, I can't let the children into the kitchen. And so now you can't be in the kitchen. And I know you love to read that book, and your favorite thing to do is snuggle in my lap and let me read and just be engrossed in you. I don't get to do that when these kids are here. And so there's this, yes, they do listen, but there's also this challenge of a 2-year-old trying to figure out, is mom childcare facility? It gets a little fuzzy sometimes. I still think it's a wonderful option. I'm not saying it's not good and it doesn't work, but it's different.
So isn't that already happening though? We already have where
right, but they're
we're
one
not
of the 10.
that.
Right, we're saying. I guess what I want to make sure is that we don't think because those 2 are related to you, they're a piece of cake. It's not always like that. And plus the relation, there's no definition as to the relation. It could be your cousin's nephew or something far where you don't have that I'm going to look at you and you're going to listen kind of thing. So I just want to.
So does that need addressed? Maybe
I do think if this moves forward, that should be addressed.
Yeah, no, I appreciate the conversation. I just know that when I have nieces or nephews that are constantly, we have that relationship, and they come over, they know the rules.
Oh yeah,
and kids are adaptable. So to be able to say, okay, when other kids are here, we don't go downstairs in the basement and play.
Right.
I mean, those rules already exist in my house, and so. Anyway, just wanted
no,
to have
I understand that. Yeah. No, I think that's a good thing to bring up.
Any other questions for the witness? Okay, appreciate that. Thank you. Next, are you in opposition? Oh, we were going to try to flip you. Go ahead when you're ready.
Madam Chair, members of the committee, Doug Nelson on behalf of Child Care Aware of Missouri. Support the previous witness's testimony, and I think the only things I would add, Senator Bratton, to your question, I think that we passed a bill about 4 years ago that allowed 2 relative kids at age 5 or older. I think when you're looking, now at any age, I think that is concerning when you can have up to 4 infants under the age of 2 in that type of setting. The only other issue that I would say in relation to the bill, if it moves forward, is the previous law had a notice to the parents that brought their children to the facility that they were now going to be at a ratio or have 12 kids. I think that's necessary here as well. That was stricken, I think, in the current bill, and we'd like to see that added back in if it moves forward. Happy to answer any questions.
Appreciate, excuse me, appreciate the testimony. Any questions for the witness? Seeing none, thank you. Next in favor? Just kidding. Next in opposition.
Madam Chair, David Winton here on behalf of the Children's Trust Fund, going on record in opposition to House Bill 835 respectfully, and totally understand this is a hard balance. And so we understand the need to expand accessibility to daycare and appreciate that very much. We hope there's other ways to go about doing that to make it more affordable for folks, and hopefully we can work on this as it moves forward.
Perfect. Thank you. Any questions for the witness? Seeing none, appreciate your testimony. Next in opposition.
Hello, my name is Nikki Rexroad. I currently serve as president-elect for Missouri AUIC, which is Missouri's state affiliate for the National Association for the Education of Young Children. I'm also a child care provider in the area, and I want to take a little bit of a different approach than some of the previous people who have sat here. I have some papers, too, that I'll leave with you guys from NACI about the cost of deregulating child care. Some of the things that I think people don't necessarily think about is insurance, right? So across the nation right now, child care providers, both in-home and licensed large centers like mine, are having a hard time finding anyone to insure us, especially at a price that we can afford. And one of the main reasons that NACI has found for the reason that we're having a hard time getting insured is this consistent problem of having too many children, right? Supervising children is hard. I do that every day. Children that are my own, children that are not my own, making sure that they are safe and well cared for takes a lot of effort and a lot of patience, and not your average person has those. So insurance companies are having a hard time insuring us. Another thing in the survey that I'm going to give to you, which is Missouri specific, is that 50% of early childhood educators are experiencing more burnout now than they have before. And some of the things that they cite for that educator burnout is workforce issues, staffing issues, and too many children. I know that we spoke earlier, or I heard you speak earlier about when I was a kid, and I was also a kid at an in-home center, and I turned out just fine. And there were 10, 12, 15 kids. I grew up in a small community. But the people who were running those centers and those in-homes are not the same as the people who are running the centers and in-homes now. The experience in society, the experience for women who make up the vast majority of this workforce are different. Our level of stress is different. The amount of things we can handle from children are different. Children are different. I think that anyone who works in education can tell you that the behaviors that are coming from children now are different from the behaviors that we have seen before. And working on processing those feelings, processing those emotions, and teaching self-regulation is harder now than it was even 15, 17 years ago when I first started my career in early childhood. We call them behaviors, and an example that I have just happened yesterday. We had a child in a 4-year-old classroom, 10 4-year-olds, 1 teacher. That's standard state licensing regulations. And this child had what we call a meltdown, or big feelings, and was hurting the other children, was hurting the teacher, and we needed someone else to come in and help de-escalate that situation for his safety, for the teacher's safety, for the other children's safety. And I hesitate and shudder to think what would have happened in that room if it were just that one adult all by themselves with 10 children. I say all the time to my staff, to anyone who will listen to me talk, that we're not making tacos. We're not talking about tacos. I can make 12 more tacos faster than 10 by lessening the quality of each taco. But when we're talking about the safety and well-being of children, there's not room to make it less quality for them. So thank you.
Thank you for your testimony. And we'll make sure to get that information out to the rest of the committee.
Add it to the pile.
Thank you. Any questions for the witness?
Sorry.
No worries. Thank you.
Thank you.
Anyone else here to testify in opposition? Seeing none. Anyone here to testify for informational purposes only? Seeing none. Representative, any closing comments?
Yeah, I would just like to say, since Nathan's Law passed, a lot of providers have went unlicensed. And what they're missing out on is fire marshal inspections, a nutrition specialist who helps with their daily planning, a health inspector who makes sure that these children have clean and safe environments, safe sleep protocol, and CPR training. So when we're driving people to go to unlicensed, they're not getting any of this. We actually don't even know where these daycares are at. So hopefully by allowing 2 more kids, this will keep people in licensed daycares.
All right, thank you. Thank you for your testimony and for bringing this bill forward. That concludes the hearing for House Committee Substitute for House Bill 835. Next, we'll move to House Committee Substitute for House Bill 850, 53, and 482. Representatives, begin when you're ready.
Thank you, Madam Chair and members of the committee. For the record, my name is Wendy Hausman. I'm from District 65 in St. Charles County. And this bill today that we're talking about is for temporary child care facility licensing. It is basically, this bill allows the Department of Elementary and Secondary Education to grant just a temporary license for child care facilities that want to expand or add a new location. So these would have all of the other qualifications. They'd have all the background checks, all the approved fire safety and sanitation requirements, but it would just allow a year temporary. Just so that we could move on and because we have a desert of child care facilities, we need desperately to have more child care facilities. And so this would take care of that. And I like my colleague, if she would like, she's also one of the, she has 850, House Bill 850, and so she'd like to comment.
Yes, thank you. Thank you, Madam Chair. Thank you, committee members, for hearing this. My name is Melissa Schmidt, District 141. House Bill 850 is my piece of this legislation. They're actually identical, passed unanimous out of the House committees and the floor. Simply, we have wonderful programs that are currently functioning under good standing, and this bill defines what good standing is. It's actually a bill that was carried last year, but we did a little more work on it this year to satisfy some of those questions. What does good standing actually mean? And so it's programs that are currently functioning under good standing, licensed facilities that simply want to expand or add a second location, and it would make that process smoother. We've heard other testimony about the need for childcare and the executive order that the governor has issued. A good chunk of my background, my professional background, was in in-home facilities, working in facilities, building facilities. Early childhood is how I've spent most of my life. And so safety for children and good options for parents is really important to me. And so seeing really good facilities in our communities that struggle to expand or offer more services to families simply because our licensing procedure needs to be a little smoother is the intent of Executive Order 2515. I'm part of that working group, so happy that I can have that voice at the table, and we can address in that executive order some of the concerns that we've previously heard. Some of our ratio issues, some of those things can be addressed that way, but I think this piece of legislation is important for right now, ways that we can get more really good quality programs open for families. And we've talked about the cost. We know that it's very expensive for families. Many of these facilities are the facilities that are taking the subsidy and really trying to offer quality services to our lower income families. So just again, thank you, and I'm open to any questions. Thankful for Representative who's come alongside to help champion this.
Thank you. Any questions for the representatives? Seeing none. We will begin with the testimony in favor of House Committee Substitute for House Bill 850, 53, and 482.
Good morning. Patty Miller. I represent Missouri's YMCAs. Patty Miller. I represent Missouri's YMCAs. We provide hundreds of child care facilities across the state. First of all, I want to thank our gracious sponsors for all their due diligence on this work. There's a reason there's 3 bills here before you. Just here to testify and support, this bill will allow good providers of care that are existing working, serving our communities well to move a little faster. Oftentimes in the licensure process, the calendar moves faster than the process. We have a lot of work to do there. This is a great first step. I have many examples from St. Joe, Missouri to Springfield, Kansas City, St. Louis, many small communities in between that have 26 sites. Most recently applied for expansion for 6 of those sites to serve 150 more kids. We can't hire staff, or we hire staff and we're waiting on timeline. We have timelines that are sort of unknown in the licensing process, and so this will just allow us to move. Summer is key for us. I know this won't take effect immediately, but oftentimes we get school districts that will ask us to take over programs. We can't respond timely because we just don't know the process and how long it will take for us to take over other licensed programs. And so this is a great way to allow good providers to provide more care and to allow more access for families that need it. So thank you all. Happy to answer any questions.
Thank you. Thank you for your testimony. Any questions for the witness? Seeing none, appreciate that. Next in favor?
Okay. Good morning, Madam Chair, and thank you, committee, for hearing my testimony today. My name is Melissa Weiner. I'm from Jordan Valley Community Health Center. In 2022, Jordan Valley opened an early childhood and family development center that partnered healthcare and dental care with early childhood services. The program has been in good standing since we opened in 2022. We did want to move facilities and move that exact footprint that was in good standing to another facility later on down the road. While we were working on moving that facility, we had tremendous problems with our licensing process. We did go through sanitation and fire inspections, local and state, passed all of those. Our program that was the exact same footprint in another location was going to just move to a different location. We were held up by several weeks, causing a lot of hardships on our parents and our organization. As an organization, we are very excited to build this unique program in several of our communities. However, we have held off due to some of those licensing procedures and just inability as an organization to financially be able to build and pass licensing processes as we move towards more offering our services and changing trajectories in other communities. So we are definitely in favor of the bill. We appreciate our representatives bringing this forward, and thank you for listening.
Thank you. Any questions for the witness? Seeing none, appreciate your testimony. Make sure you leave your witness form there on the table. Next in favor?
Good morning, Robin Shelp with Kids Win Missouri. Just want to go on record in support of this. We think this is a good approach to helping get more children into childcare, and I just want to thank the sponsors for their work on it.
Thank you. Any questions for the witness? Seeing none, appreciate your testimony. Next in favor?
Morning, Nikki Rexroad again. This time I'm only speaking as myself, not as Missouri AUIC, just to clarify. I just want to tell a quick little story about how a bill like this would have impacted me. I opened my 4th facility during the time that there were all those awesome grants for expansion and new centers. And because of staffing changes and things in the licensing world, I missed the deadline to receive a grant of over $250,000 by 4 days. And so if this type of bill had existed, I would have been able, and I did still open the center, but that $250,000 would have meant new playground equipment, curriculum, staffing, bonuses, those kind of things that would have been transformative in my industry. So as a provider who would have and hopefully will in the future benefit from this bill, I thank you very much.
Thank you. Any questions for the witness?
If the grants weren't available, would you have ever opened those facilities?
Definitely not at that time. I took over a facility in New Bloomfield that was being shut down. They announced, hey, we're closing in 5 days. I own a large facility in Holt Summit, so New Bloomfield was not too much of a stretch. We decided to go ahead and make a jump for it because that's a small community and there's really only the one center. And so because we do this, because we love children and want them to have quality education, my business partner and I jumped in while we were also opening one in Jefferson City. And the reason we were doing that is because there were all these grant opportunities available and we didn't end up getting that. We're still pushing on, but we would not have at that time done it if we thought we were not going to get that. I mean, $250,000 is a lot for us.
Thank you. Any other questions for the witness? Seeing none, appreciate your testimony.
Thank you.
Thank you. Next, in favor? Going, gone. That concludes testimony in favor. Is there anyone here to testify in opposition? Seeing none. Any here to testify for informational purposes only? Seeing none. All right. Representatives, any concluding comments?
Just briefly, thank you so much. And we know this is just a piece of this bigger solution. So thank you for hearing this.
All right. Appreciate your testimony. All right. At this time, we are going to take roll. So, Mr. Chair, Secretary? Yeah.
Senator Bratton. Senator Carter.
Here.
Senator Lewis.
Here.
Senator Hudson.
Here.
Senator Nicola. Here. Senator Nurnberg. Okay.
Okay. Having established quorum, I make a motion that we go to executive session. Can I get a second? Thank you. I make a motion to bring House Bill 121 relating to newborn safety incubators before the body. Can I get a second?
Second.
House Bill 121 is before the body. There is a Senate committee substitute ending in .02C. Is there any discussion? Seeing none? Oh, all right.
Thank you, Madam Chair. You know, when the representative came before the body and talked about this legislation, it was non-controversial, had unanimous support in the House, and I find it very disappointing that now there's a provision that is adding some controversy to the bill.
All right. Any other discussion? Seeing none, I move to adopt Senate committee substitute for House Bill 121. Can I get a second?
Second.
All in favor?
Aye.
Thank you. I move to do pass Senate committee substitute for House Bill 121. Can I get a second?
Second.
Secretary, please call the roll.
Senator Bratton.
Aye.
Senator Hudson.
Aye.
Senator Nicola.
Aye.
Senator Nurnberg. Senator Lewis.
No.
Senator Carter.
Aye. With your vote of 5-1, the bill is due pass. I now make a motion that we bring House Bill 243 relating to the dissolution of marriage and pregnancy before the body. Can I get a second?
Second.
House Bill 243 is before the body. Is there any discussion? Seeing no discussion, I move to do pass House Bill 243. Can I get a second?
Second.
Secretary, call the roll.
Senator Bratton. Senator Hudson.
Aye.
Senator Nicola.
Aye.
Senator Nurnberg. Senator Lewis. Senator Carter.
Aye.
6-0.
With your vote of 6-0, House Bill 243 is due pass. I now make a motion that we bring House Bill 177 related to Missouri HealthNet coverage of hearing instruments before the body. Can I get a second?
Second.
Thank you. House Bill 177 is before the body. Any discussion? Seeing none, I move to do pass House Bill 177. Can I get a second?
Second.
Thank you. Secretary, call the roll.
Senator Bratton. Senator Hudson.
Aye.
Senator Nicola.
Aye.
Senator Nurnberg. Senator Lewis. Senator Carter.
Aye.
6-0.
With your vote of 6-0, House Bill 177 is due passed. I now make a motion that we move out of executive session. Can I get a second? Thank you. I now make a motion that we conclude the hearing for family, seniors, and health. Can I get a second? Thank you. All in favor, say aye. Thank you. Thank you.